Hello there. Yes, it's a pleasure to meet you. My name is Oliver, and I'll be your doctor for today's appointment. Please step right in and have a seat right there. I am running a little bit behind schedule. I apologize for the wait at the front, and I'll just have a flick through your chart. I know you already filled out a fair few of the questions relating to your medical history on the online questionnaire when you booked your appointment. However, I would just like to clarify a few things in person upon perusing your chart. So, I see here, of course, when seeing a new patient, we would like to make sure we have the right patient, of course. You wouldn't think it happens, but yes, sometimes we get the wrong patient. So if you could please tell me your name, full name, as well as your date of birth, please. Just to confirm things, that would be greatly appreciated. Okay, that's good. We definitely have the right person. And based on your chart, I don't have much in the way of your medical history. I'd just like to confirm face to face and let me know if there's any medical conditions or familial history that you can tell that to me now, please. So things such as a history of high blood pressure or hypertension, or potentially respiratory conditions such as asthma, anything like that, anything that you can think of that may be relevant to today's exam. Okay, right. I might just go ahead and document that for next time. And that way you won't have to keep explaining yourself, and the next doctor will know exactly what you're talking about and have all relevant information. So, for today's exam, I see that you are booked in for a general appointment, general exam. What that basically entails is a set of OBS, or your vital signs, things that I'm sure you're familiar with, such as your blood pressure, your heart rate or your pulse, your respiratory rate or your breathing rate, as well as your temperature. These are very important, these vital signs. They can tell us a lot about any sort of pathology or the state that you are in, and may help us detect any issues that there may be. So, for today, I will be needing to get up close and use my hands. And as part of my personal protective equipment, I'll just be placing some gloves on my hands. So, allow me to don these gloves. And in the meantime, how are you feeling about today? Are you nervous or anxious or confident? Okay. No, it's okay. It's okay. I understand. Thank you for letting me know. I'd rather you tell me now rather than later. Yeah, communication is key in these sorts of exams. So, thank you for letting me know. these are latex gloves, so I hope you are any allergies to. Okay, that's good. We'll proceed then. Just allow me to get this one on. In the meantime, have you had a set of OBS or your vital signs checked in the past? I see. It is a painless process. We won't be using any invasive techniques. Nothing invasive will be used throughout today's assessment. So, allow me to prepare. I'll just get my little bag of goodies. This one here contains what we call a sphygmomanometer. A sphygmomanometer. And this will be used to measure your blood pressure manually. I should also mention that we will be checking your eyesight today, as I'm sure you could see behind me the Snellen chart. Snellen chart will be what we will be using to assess your eyesight. So, this is what a sphygmomanometer looks like. You may have seen these before in the movies or on TV. Essentially, the anatomy of a sphygmomanometer, say that 5 times fast, is this little gauge that we have here, a gauge. We also have we also have a rubber bulb that we can use to inflate our blood pressure cuff. This one right here. You can see there are instructions as well to make it super easy for anyone who is not familiar with operating one. Placing it on the left arm where the brachial artery sits. This will go on your upper arm in the biceps or brachial area. As I will be going in quite close, I'm going to add another layer of personal protective equipment on in order to protect myself, but also you. Infection control measure. Just place this mask on. Get myself comfortable there. Okay. Now, can you still understand me okay? And please let me know if you require me to explain something again or something doesn't make sense. I'd be more than happy to explain. So, here we are. We'll just start by placing your left arm out with your palm facing up for me, please. Here we are. We'll just attach the Velcro piece. If you could just hold that arm out extended, please. We'll just wrap that one around. Perfect. Now, we're almost there. I'm just going to use my stethoscope here now to listen to your pulse. Specifically your brachial pulse, or radial, but I'll be using your brachial pulse for the time being. This is a Littmann stethoscope, Littman, I believe. Yes. 2 N's, 2 T's. Littmann. There you go. So, let's get this one underway. Just apply this one on. Here we are. Now, this one's just going to sit on your brachial artery there. Excellent. And now, just using the gauge, pump this one up. Make sure the air is not coming out. How are you feeling? Yeah. Okay, and we'll just let that one slowly release. Should feel the cuff nice and tight around your arm. Just going to slowly release some of the air now. And listen. Okay, just releasing that air slowly. Excellent. Okay. Perfect. So, good news, that's all within normal ranges for your age and demographic. I'll just take this one off. It does get quite hot under these things, but just dispose of that one. And how are you feeling? I'll just take that cuff off of you. That's it, sit tight. Just get this one off. You're doing great. Excellent. Okay. Right. That one is all done. Let's put the Sphygmomanometer away. Next up, I did want to check your eyes, your vision, etc. So I have with me a little LED torch, and we're going to be using it to perform some light tests, more so to test some reflexes in your eye, and perform a bit of an eye exam. So, if I could ask you please to fit your gaze straight ahead. Look straight ahead. And I'm just going to be testing your eyes for what's called a pupillary light reflex. This one is going to come across into your field of view, like so, causing your pupil to constrict. Now, still, maintain that gaze ahead, and let's try this on your other side as a comparison, making sure that you are recording a normal response there, with your pupil restricting in response to the light. Okay, just try to keep your head still there. Okay, have a break. You're doing wonderfully. Everything is going well so far. Have a breather. Also, by the way, while you were doing the blood pressure stuff, I was observing your rise and fall of your chest, or your respiratory rate, and that is also within normal limits. So, that's good. Always good news when things are WNL, or within normal limits. Bit of medical abbreviation or shorthand for you there. WNL, within normal limits or ranges. Now I'll just double check and make sure that we get a few checks on both sides here for your pupils constricting. Excellent. Well done. Fantastic. So, I'll just put this one away. What's this one? This one here? Ah, good question. It's just a Theraband. We sometimes dish them out to patients as a exercising tool. So has some resistance depending on the colour: blue, green, red, yellow. Increased tensile strength depending on the colour. And these are effective home exercise options for strengthening programs and such. But I like to keep one in the clinic just so I can demonstrate some exercises to people if needed. I do recommend picking one up, yes. But maybe we can check that out another time. But for now, let's continue with the eyes. Now, do you normally wear any corrective lenses or glasses or spectacles? Anything of the sort? Okay, well, let's see how we go then with a little bit of a eye test using our best friend, our Snellen chart. Snellen chart, yes. Let's see now. I want you to start by making sure you're about 3 feet away from the chart. So if you could just turn around there, can you see a little marking on the floor behind you? Yes, that's the one. Yeah, I'd just like you to stand at that line, as that is our 3 meter line. I want you to then cover your right eye with your palm of your hand, and I'll just make sure that there's no cheating going on there. I know you seem like an honest person, but you can never be too careful, and it's for your own good anyway. So make sure you're covering your right eye completely with the palm of your hand. Now, just let your eyes adjust to the surroundings, the brightness and such. And I'll just ask you now, generally I would ask you to read the lowest line possible that you can see for efficiency's sake. But for today's assessment, I'll just get you to read from top all the way down to the lowest line possible. Okay, so let's begin, and I'll just actually roll my sleeves up here as it's getting a little bit warm. The seasons are starting to change after all, so forgive me. Just undo this one as well. You can get warmed up with your eyes in the meantime. Here we are. That's much better. I try not to crinkle my shirts, but for the sake of efficiency. Let's continue now. So, reading from the top line for me. Yes. Yeah. And just reading the lines that I point to, please. Yeah. Okay. Good. Continue. This line here, number 3, line 3. 3. Okay. Feeling okay? Not dizzy or anything? Remember to keep covering that right eye. Let's continue. This line for me now, please. Okay. And the one below. This one. Excellent. And the next one, please. Perfect. Okay, we're doing well. Don't be discouraged. Let's continue. This one here now. Again, just to the best of your ability. Just checking. Okay. Now it's getting to be quite difficult now, so let's just see how you fare with the last 3 lines. Again, don't be discouraged if it's quite difficult. That's the intention. Now try this one for me, please. Perfect. This one now, please. And the bottom line. Okay, yeah, I see. I'll just record those results. 4. And how are we feeling? Okay. Like I said, no reason to be worried. This is just a general exam to make sure, see how you're going. And from as far as I can tell, we're doing quite well, in my professional opinion, yes. So, we're not done just yet. I did just need to take your temperature now, so if you could just have this one underneath, or actually, we have 2 modes of measuring this. I do have an auxiliary one that goes underneath your armpit, measures your temperature through that way, but we did have one of those fancy ones that you put to the forehead and can measure your temperature there. So we'll just have that one a few inches away from your forehead. That's good. Okay, just checking the reading there. Error. Okay, that's alright. They do these sometimes, but just have your, if you could just maybe brush that. Yeah, just that piece of hair there. Perfect. And again. Excellent. Now, that's a better reading. That's all within normal limits, and what did I say earlier? WNL, within normal limits or ranges. Perfect. Let's just have a quick listen to your lungs and your breath sounds while we're at it. If you could just please take a deep breath in through the mouth and out through the mouth. Inhale, exhale. Yes. Now, this is a little bit cold, I know, but it's just going to have to go onto the bare skin. Yeah. So, what I will do is, are those clothes, is it okay if I just have the stethoscope sort of on the skin there? Yeah. Sometimes the clothes can interfere with the reading, and you might hear things that you shouldn't really be hearing. It might mess with the quality of the sound, essentially. So I'll just warm that one up for you, because they can be quite cold. And let's see how we go. In through the mouth, out through the mouth. So here we are now. Deep breath in. Excellent. Just on the front all of your chest there, the anterior portion. You're doing well. And then the next one. Okay. That concludes the front area, or the anterior part of our body. I'll just apply this one now on your posterior aspect of your chest, or not your chest rather, posterior aspect of your body, on the back essentially. So, same thing, I'll just have it on the skin there, yeah. Exactly what you did just before, that was perfect. So just reaching around here, take a nice deep breath in. Perfect. Well done. No, you're doing well, no stress. Keep it up. One more point. Okay. Well done. And that concludes our auscultation. And no issues there. All your breath sounds are within normal findings. Very good there, getting air into the bottom parts or the bibasal aspects of your lungs. No crackles or signs of crepitus or sounds there that are out of the ordinary. So, thumbs up, double thumbs up. We're almost done with today's session. I was running a little bit late to begin with, so I think I owe it to you to take a bit of extra time with you. And I did happen to catch that you were after maybe some breathing techniques in the case that, touch wood here, in the case that you did have some breathing issues, such as difficulty expectorating or bringing up mucus, fluid, phlegm, secretions, that type of thing. So what I will teach you is a breathing technique that we use as a mucociliary clearance technique. Fancy word for saying coughing up phlegm and secretions, mucociliary clearance. But it can also help with your ventilation of your lungs, improve the quality of your breathing, essentially, and also the effectiveness of your cough. In the hopefully non-existent case that you have trouble bringing up secretions rather, and have trouble with your breathing. So, again, should be a painless thing. So we're actually going to go through it together. I find it's easier if we do it together. We'll start by taking 20 to 30 seconds of controlled, relaxed breathing, just to get your rhythm going. Now, we might just do it for 10 seconds. So if you could just go ahead, feel free to close your eyes and breathe normally. Just your normal resting breaths that you would take if you were sitting down, or if you were just walking at a slow pace. Very well done. Okay, next I would like you to take some deep breaths in, practicing what we call thoracic expansions. So where you are breathing into the chest, in through those areas, just above the diaphragm there, really expanding that chest, getting as much air in through there as possible. So, let's do that now. Let's take 4 deep breaths. Perfect, that was excellent execution there. We're now going to follow up, and this is where the cycle comes in, active cycle of breathing, this technique is called. We're now going to repeat that cycle another 2 times for 3 repetitions of that cycle total. So we do our controlled breathing, followed by our deep breathing, followed by controlled breathing again, deep breathing again, controlled breathing again, deep breathing again. Once we have reached the end of that cycle, we're then going to try our expiratory pressure technique. So there are 2. One is a huff, almost like you are fogging up a mirror. That type of action. And then, if you need to, you will then cough in order to move those secretions, get that phlegm moving. So let's practice the huff together now. 3, 2, 1. Exactly. Idea is you're trying to get that air behind the secretions in your lungs and into the larger airways, which will make it easier for you to cough and expectorate up and get them out of your airways. So that's been active cycle of breathing, and this is more something to do if you do find that you are having some troubles with your breathing or coughing things up. But that essentially concludes today's examination. I will email you a copy of our results that we've had today, but straight off the bat, as I'm sure you already know, everything was all okay within normal limits, as we have discussed throughout today's exam. So, all smiles. I would just like to give you our business card. Just something to hang on to for the next time you require a medical appointment or checkup. My name has been Oliver, and I hope you are feeling amazing, and all the best. Feel free to come back if you have any more questions, queries, quandaries. If you could just have some sanitizer on the way out and have a chat to our lovely, lovely, lovely receptionists to sort out your file, etc. But thank you for coming in. Till next time. Yes. Thank you to my amazing patrons: Megan, Electra, Amado L, Joaquin, Gabriel, Patrick, Troy, Andres Solan Vasquez, Stephen Underwood, Anthony Espinoza, Michaela Rajanen, Blaine Bettinger, David Emmanuelson, Beth Burton, Josh Santana, Fun Size Kiki, Fading Muses, Here's Mikey, Curious Mad Cat, Stephen Joyce, Abby Lynn, James Peacock, Jessica Montez, Kylie Denton, and Stephanie Hood.